So good morning, Miss Carol. John Dombrowski here, Washington Pain Center. So you were kind enough to maybe talk to patients or watch this video about a thing called Vertiflex. So let me kind of tell you a little bit of your history and make sure I got it right. So you've had this back pain for about 6 months to a year. Fair?
Fair.
And did it go anywhere or just did it remain in your back at that time?
It went down my leg.
Okay, which one was it?
The right leg.
Okay. And you, sounds like you've been to like a neurosurgeon at the local hospital here as well as Georgetown, and they really didn't offer you very much.
Right.
Okay. So somehow you got to see me. How did we find one another?
A friend told me that she came to you.
Okay. And we had done some injections for you and even some medication that really wasn't helpful?
No, not really.
Not really. Oh, shucks. So then we ended up doing a thing called, or we talked about this thing called Vertiflex. So we ended up putting in a spacer, and the spacer, if you want to hold it, looks like that. I'll hold it to you, and you can show it to the camera. So it looks like that spacer looks like that. Let me get a better picture. Oh, hold it right there. And so the spacer kind of opens up the spine. Now we just did this, I'll hold it back, about 2 weeks ago. Fair?
Fair, 2 weeks ago.
Okay. And how was the process? Well, I guess the first question is, how you doing?
I'm doing much better.
How much percent better is better?
70%.
Excellent. Oh, you told me 75 before.
75.
That's okay.
75.
And during this time of the surgical procedure at a surgical center, did you find it uncomfortable, or was it, how was it to you?
You mean after?
Yeah.
It was uncomfortable for about till today, actually.
Okay, but then have done quite well.
Yes.
Okay, great. And if patients are more mature, if patients are afraid of traditional back surgery and they have this thing called stenosis, or like you have, what would you tell about this Vertiflex procedure? What do you think?
I think it's well worth trying. I tell them about it. In fact, I've showed some people.
Really? You've already been marketing it for
Yes.
them? Oh my goodness. But in terms of the recovery or everything like that, did it seem pretty straightforward to you and what you've been doing?
It has been.
Okay, great, great, great. Well, listen, thank you so much for your time. I really appreciate it.
Okay.
Thank you.
You're